Hi there, and welcome to Naturally Recovering Autism. I am your host, Karen Thomas, and I want to thank you so much for being here and being a proactive parent and getting the resources that you need to let your child live their most fulfilling and independent life possible. When my own son was diagnosed with autism, I was told to drug him and try behavioral therapies, and there was nothing else that we could do for him but manage his symptoms the rest of his life. But I didn't want to do that. Fortunately, my background in craniosacral therapy of now 30 years let me know that the brain can and does heal, but I didn't know that much about autism. What I did know is that I didn't want to just mask the symptoms with dangerous drugs. I wanted to find the causes and work with them naturally. And fast forward, it took me a decade and a lot of time and effort, but today my son is no longer diagnosable with autism after being told it could not happen. So I'm here to share with you valuable resources to save you the time and some of the expense that I had to spend to figure it out, and to help you let your child lead to their best results possible. Every child's level of recovery is different, but we know that children who couldn't sleep through the night are sleeping now through the night and happily. Their immune systems are now strong where they were once sick all the time. Children who were nonverbal and their parents were told they could never speak are now speaking. Children who were getting D's and F's in school are getting A's and B's, and those that were so anxious all the time and couldn't sit still and were uncomfortable in their own bodies are now calm and happy and relaxed, and they're leading fulfilling and independent lives with friends. This is what we want for our kids. So I'm here to share the resources with you so that you can get the best results for your child, the best possible. And you can start that right now with my free download of the top 7 foods to eliminate beginning today, of the top foods that are the most inflammatory and toxic that are contributing to those physical and behavioral symptoms of autism that your child is having. They're making his life uncomfortable. So you can get that right now at naturallyrecoveringautism.com/7 foods. And feel free to share that with anybody you know who would be interested. And I will also link to it in today's show notes. There's, of course, a lot more than diet, but this is something you could start doing today that will begin to reduce those symptoms. And I'm happy to share everything I can with you. So right now, let's dive into today's episode.
Hi there, and welcome back once again. Thank you so much for being here, being such a great parent, getting educated for the resources that you can use for your family, and especially your child with autism. We have a very important subject today that in the 18 years I've worked with autism that I see over and over again. It's too prevalent and it needs to be stopped. And this is about oral health and tooth decay. And if you have a child with autism, it's very likely that they've had problems with their teeth, whether it's decay, but many times I hear from parents that it's to the point of needing extractions, even multiple extractions. And there is a way to utilize proper prevention. And of course, we have to work with, healing the gut, which helps to just build the microbiome and the healthy bacteria in the body. And then getting the toxins and the co-infections and the pathogens that, I always talk about. All of this has to be done because it's contributing to the lack of mineral absorption, nutrient absorption, and all of this. But additionally, and one thing we're finding is that there is not enough emphasis on the right type of oral care and what you can do about it. So we're fortunate today to have Dr. Stephen Branam here, who is a pediatric dentist who has had a practice with pediatrics, again, for over 48 years now. And I'm thrilled to have partnered with Dr. Branam to bring you this very important topic and subject and education around it to help you understand things that you can do at home for better prevention and just more knowledge about, what to do about oral care in general. And so just a little background again on Dr. Branam. He's been in practice for over 48 years as in pediatric dentistry specifically. He has developed technology starting in 2009 for the production of various oral care products. But in 2019, he actually presented and started producing xylitol toothpaste and gels. You may or may not have heard about this yet, but we're going to cover it today. To the point is to significantly increase the incidence of tooth decay in children 5 years of age and younger in America. And the Center for Disease Control, the CDC, has actually determined that tooth decay is the #1 chronic childhood disease in America. And children ages 2 to 5 are actually the most prevalent in this problem. And this, we're going to go over maybe why this is. Dr. Branam has actually developed a highly effective toothpaste formulated with xylitol, an educational format and effective system for his patients. He's used this system in his own private dental practice and has reduced the need for invasive routine dental treatments by approximately 70%. The products have been tested and a conclusive proof has been shown in the concept by the University of Toledo, Toledo, Ohio Medical Center. And I will link to the studies and various things that we discussed today in the show notes, which will be at naturallyrecoveringautism.com/207 for this episode. So Dr. Branam, thank you so much for being here today and for sharing your education and your knowledge with us. There are so many parents who need and are listening right now to get the value that you have to share about this such an important topic. So maybe give us a little background, starting at the beginning.
Okay, well, first of all, thank you for having me. I look forward to this presentation. I've been thinking about it for quite a while because it's something that I deal with every single day in my office. I was trained at Riley Children's Hospital in Indianapolis, Indiana, back in the 70s. And at that time, tooth decay was an issue, but literally now the condition has exploded. Yeah. I shouldn't use the word condition because tooth decay is actually a disease caused by bacteria. And you've already touched on the fact that healing the gut is important for autism patients. Well, your mouth is loaded with bacteria, all kinds of bacteria. There's good bacteria, there's not so good bacteria that causes tooth decay, and all this kind of stuff. My toothpaste is specifically designed to reduce the level of strep mutans, which is the primary cause of tooth decay. And it's very successful. It took me 2 years to formulate this toothpaste. I had it clinically tested, as you've already mentioned, and I've been using it since 2019, and it's been very effective. The other thing I want to mention, too, is the fact that the explosion of the diagnosis of autism has become a real daily concern for me because I have to deal with it. Mm-hmm. As a pediatric dentist, and I don't think of myself this way a lot of times, I'm actually a surgeon. And so what I am charged with doing is fixing these decayed teeth and correcting them. Well, to do that, it requires cooperation. I'm working in an area that's 2 millimeters in diameter. Usually cavities are not big, teeth are not big. So unless the child can sit still and cooperate, it's virtually impossible to provide routine care. So my goal has always been, but especially now, is to minimize your child's need for treatment. The less I do, the less the dentist has to do, the better off the whole family is. Parents, siblings, and the child I'm treating. Mm-hmm. So that's kind of like my history. That's how I arrived at this point in my life. And there's a real need to reduce tooth decay in patients with special needs and autism.
I think parents too don't realize that, we pass bacteria around the family. So, we share an apple, we share a drink of water, we share a fork, we kiss on the lips. All these things are passing the bacteria in our bodies back and forth. Sometimes parents are doing all this really great work with their children with autism, maybe, but they're not doing things for themselves and the rest of the household. And so it can be continued to be passed around. And you mentioned strep mutans, which I think it's important to elaborate on the importance of this bacteria and what it means. So would you explain that just a little bit further too?
Yeah, absolutely. Just to touch on briefly, preventing tooth decay actually begins before birth, if you want to be idealistic about it. And it's both the mother and the father. And you're talking about transferring bacteria. When an infant is really young and you're kissing him and you're playing with them, they'll stick their hands in your mouth and you love it and then they'll stick their own hand in their own mouth, and you've transferred the bacteria because the bacteria are invisible. So what the parents really want to do is lower their own level of strep mutans before the child is born. That way you'll have a less likelihood of transferring it. But let me give you a brief explanation of what happens. 90% of the sugar you eat is digested in your mouth. That's refined sugar, natural sugar. And you have to remember there's natural sugar in everything. There's juices, which ain't fructose, maltose, sucrose, all this stuff. And of course, then there's natural sugar also. So to make a long story short, what the bacteria do is they digest or they metabolize the sugar, turn it into acid, and the acid is what destroys the enamel of your teeth. So if you eliminate this metabolism or conversion of sugar into acid, you've eliminated a lot of the cause of your tooth decay. And that's exactly what xylitol does. Xylitol is digested in your stomach, not your mouth. So when it replaces the sugar in your mouth, the sugar level of refined sugars drops, which decreases the amount of acid that can be made by those bacteria. So it literally is a healthy sugar that meets your sugar needs, but it decreases your level of acid that causes cavities. So it actually does, it's a proper way to consume sugar. And then stevia is another way. So I don't know how much you've talked about those two things as far as gut health goes, but just for your health in general. And I'm talking about diabetes also, obesity. All these problems are caused by sugar. And I just to let you know, let your listeners know, it's impossible to eliminate sugar from your diet. You cannot do it. You want to minimize it. I just read a study, and I read studies every month. 3 months ago, in 1960, the average American ate 5 pounds of sugar a year. In 2023, the average American ate 100 pounds of sugar a year. There's 20 times more sugar in your diet now than there was when these parents were children. And you don't even realize it. You have no clue, and they're not going to tell you.
Right. Often they're using high fructose corn syrup and other things that are like really, really harsh on your bloodstream. It's important for the audience to know, like, stevia is a natural sweetener and it's safe and it doesn't feed the pathogenic bad bacteria. And it's actually a 0 on the glycemic index. And the glycemic index goes from 0 to 100, 100 being the worst, where you see things like white sugar up there. Where xylitol, I was looking recently, and it's about a 7, a very, very, very low 7 on the glycemic index. But the beauty of xylitol is that it actually fights this bacteria in the body as well. So maybe you could kind of explain how it does that. If or is there some background that we can learn about that?
Sure, but there's all kinds of information about xylitol on the internet. I mean, there's all kinds.
Yeah.
I discovered xylitol myself in Scandinavia because I invented a pacifier. I did a lot of research there, and I won't go into the reasons why. But they have national health insurance in Scandinavia. Their goal is to minimize your need for medical and dental treatment. So they've been using xylitol since the 70s in Scandinavia. And I've actually visited there, both pleasure and business. But if you look at European people, they are much healthier than mainstream America. I mean, they're much healthier. And it's because of their diet. And part of their diet is stevia and xylitol. It affects the whole body, not just your mouth. But I don't begin to. I'm not an expert, quote unquote, on xylitol. I know enough that I know that it really, really works. But I would encourage people to go read about it. It really does, and it's good for the entire family. The entire family. Okay.
Yeah, absolutely. There's for the xylitol also, some people, if they have too much, we're talking large amounts. I just read something on 20 grams. You can get like a little bit of stomach upset because it has some fiber. But the amount they're going to swallow in a toothpaste or a little bit eaten, as long as it's in moderation, is absolutely fine and can be helpful. Correct?
Correct. If you get symptoms of having too much xylitol, you'll become gassy or bloated or burpy, but that's very, very difficult to do. You have to eat a lot of xylitol.
of it.
A
Yeah.
lot. I'm talking probably half a pound of xylitol to
Right.
sitting or something.
Nobody's.
It's extremely safe. The other
Well,
thing I will mention, you will not be able to find xylitol studies on xylitol toothpaste except mine, because most of the studies that have been done in the United States on xylitol are in lollipops, mints, chewing gum, and that's fine. But the focus for mainstream dentists and for the American Dental Association is on adults, because that's 90% of the population of America is over 18 years of age. So if they're going to focus on something, they're going to focus on people over 18. And that's where children have kind of been lost. And it's a very sensitive issue for me, because I've been doing this for 48 years and I have literally watched tooth decay get worse. I mean, it's very evident to me. I see it every day, but most importantly, I have to treat it. I have to deal with it. And I know it's preventable. At least you can minimize it,
right.
but you can't minimize it doing what we're doing. We have
Right.
to do something different. And that's what I've proposed. And that's what I've invested time, money, and energy in, is making a product that I know is beneficial, not just to the child, but to the entire family.
Mhm.
And it's going to take time, but as I tell everybody, it took 35 years for tooth decay to become the #1 childhood disease in America. So it's probably going to take 35 years to turn it completely around, but you have to start somewhere. You have to
With more
start.
sugar consumption and worse diets, these things are
Right.
increasing because it has to do with the things that we've already mentioned. And,
Mhm.
diet is very, very important. And parents need to just become more educated on the right foods and the wrong foods. But as you're saying, the xylitol at least is able to fight the strep mutans in the mouth, which is the bacteria that creates the dental caries. And it's also safe to swallow, which is something that's really important, because I hear from parents all the time, my child can't spit and they swallow anything going in their mouth. Well, a
Mhm.
lot of toothpaste you do not want to be swallowing, especially if it's got some toxic ingredients with, that many things are carrying that we're used to hearing to use, that is supposed to fight tooth decay, but that there's a neurotoxin involved, where xylitol is really safe. So if your child is brushing their teeth and swallows some of it, it's not a problem at all.
Actually, I recommend you leave my toothpaste in your mouth, because that's how it works the best. No, you do. You don't spit it out. You brush your teeth with it, and then you go to bed. And the most important time to brush your teeth is bedtime.
Mhm.
Only 47% of all people brush their teeth at bedtime.
Is that
47.
right? Wow.
Yes, 47%. So, and they pass that along to their children. And
Mhm.
I've been thinking about this quite a bit for the last week. If you do three things, you're going to significantly reduce your dental expenses and your need for dental treatment. Number one is brush your teeth at bedtime. Number two is use a xylitol toothpaste, because it's safe, it's healthy, it's not harmful, it contains no toxins. And number three, get regular checkups.
Mhm.
Because what happens is, what I see is people, they have this stigma about going to dentists, like it's going to be painful, it's going to hurt, it's going to be costly, it's going to be expensive. So what do? They avoid going to a dentist. Well, by avoiding going to a dentist, you're just increasing your risk of having extensive work. And,
Mhm.
and they don't understand their dental insurance either. Let's be practical about this. I mean, people have to be aware of their costs for a family. Dental insurance is set up so that they pay very well for preventive services, usually 100%. So you can go for a 6-month checkup, get your teeth clean, get some x-rays, whatever you have done, and it'll be paid for 100%. If you don't go for 2 or 3 years, you go in there and they say you've got 5 fillings to do, they pay 50% for treatment.
Mhm.
They pay 100% for prevention. So, and only, like I said, 38% of all adult Americans go to a dentist annually. So if you want to be really practical about this, dental insurance is a huge moneymaker for insurance companies, because they know that only 38% of the people that they write a policy for are going to use it.
Never use
And
it.
it's
Wow.
unfortunate.
Yeah.
Parents need to
Wow.
know that going to the dentist on a regular basis it'll save them money. It'll save them treatment. It saves them discomfort. There's nothing you can't save by seeing your dentist every 6 or 8 months. It's extremely important.
Well, and if a parent has a fear of going to the dentist, they, anything, fear, I've seen this with a parent having a fear of water, swimming, and their child has the same fears. Our children are watching us and think, well, if there's something scary about that, mom's afraid of it, then I should be too. But the other thing is, let's talk about this is important because children with autism have a lot of sensory overload issues. And being taken to an office appointment sometimes can be, scary or traumatic or triggering for them with, some of their anxiety and other episodes that can happen. And if they're in a dentist chair, having bright lights in their face and whirring sounds and, other, having to lie down with somebody over them. So how can a parent help, calm their child in a dental chair, make this experience a bit more pleasant or easier for both the parent and the child?
Okay. Well, it's a combination of things. I'm glad you brought this up because, again, I will say most mainstream dentists they're not taught this in dental school. Only pediatric dentists know what I'm going to tell you right now. First of all, I went to a presentation by an optometrist who's out of Denver, Colorado. And to make this presentation very short, 3 things exacerbate a child's, I will call it poor behavior or different behavior if they have autism. Bright lights, laying flat on your back, and loud noises. That's exactly what you do if you go to a mainstream dental office. They lay you in a chair, flat on your back, they shine this light in your eyes, and they start polishing your teeth with this noisy handpiece. What we do in my office, I sit the patient and the parent in the chair together in a regular chair off to the side of the dental chair, and I interview them. I talk to them. I ask them about their history, all this kind of stuff. We talk for at least 3 or 4 or 5 minutes. I introduce myself. I'll touch the child. I'll try to touch him if they will do that. And so they know me as a person, not just as somebody who's going to get in there and do something that they might not like. Then I set the chair up at a 45-degree angle. I don't lay them flat on their back. I don't use the handpiece unless I have to. I use the light minimally. And the first thing I do is I brush the child's teeth because I want them to know that what we do in a dental office can be similar to what they do at home. And that's how you start. Then I pick up the mirror and I rub that on their face and I talk to them. I show them the mirror. I look at their front teeth. I don't stick it back in the back of their mouth. I don't pick up that explorer, the pointy thing. That's what the kids got, the pointy thing. I don't want the pointy thing because they think that's a shot. They think that's going to hurt them. They think that it's going to be something bad. So I don't pick that up until the very, very end, only if I need it. And I say that because if I see a child early, and I'm talking about when they're 15 months of age, they have no tooth decay. The purpose of taking your child to the dentist when they're 1 or 15 months old is to acclimate them to dentistry. I don't want to have to fix their teeth. I don't want to have to shock them. I don't want to have to alarm them. I don't want to have to give them a bad experience. And the more experiences they have, just like you were talking about, the more likely they are to enjoy it eventually. We have a saying in our office. Remember, all of our patients are good in the end. Some just take longer than others, And that's true of everybody because we don't want them to fear going to dentists. That's why only 38% of all adults go to a dentist. If you interview them, which I do, it's because of experiences they had as a child.
Right.
And you're right. They pass that along to their children. And you have to almost turn the ship around. You have to let the parent know that, and I tell them all the time, this isn't the 1860s where we have you bite on a bullet and we fix your teeth. This is modern dentistry. It doesn't have to be painful. It doesn't have to be difficult. It should be easy. It's different than what you experienced as a child. So a lot of it is you're right, is talking to the parent, making the parent comfortable because children pick up on their parents' anxieties. It's normal. They know that. So it's how you approach it. It's not, don't treat them as mainstream because right now they're not. They may become mainstream, but you got to start them out differently. You have to start them out slower, and be aware of what their sensitivities are. That's what we do. That's what I do. Okay.
Right. Well, it
That's what I
makes
teach
sense.
residents.
Yeah, to take your child in when there's not a problem and it's just a
Correct.
routine checkup. When people think, well, why spend the money? Well, because it's prevention, for one, making sure that things don't get out of hand and they become a much bigger issue, which can be much harder to take care of in the future. But
Mhm.
also having a child just come into a dentist's office, seeing it as a normal experience where it's, no big deal. And so they don't fear it in the future and have this be part of their process as they grow up. And if we're practicing prevention, with the toothbrushing with the right things and eating the right foods and going to regular checkups, then we're going to not have future problems. Hopefully, like our point is to really create a better environment all the way around for prevention, so that things are just better in the long run, and you don't end up having to have extractions and major things going on.
Yeah. When I talked about interviewing the patient too, I interview the parent. I find out what they're doing at home.
Mhm.
Tooth decay is not prevented in a dental office. We can help you, but we don't prevent it
Right.
usually. It's prevented at home. And unless you're doing the correct things at home, then you're going to run into difficulty when you go to a dental office. So I find out what the parent's history is. I want to know if they've had cavities. I want to know if they brush their teeth, because only 47% of all people brush their teeth at bedtime. A lot of it's education. And uh, and that education actually starts, you need to go when you're 1 year old. Just put on your calendar your first birthday. Actually, yesterday, I saw a child who was 17 months old who has 4 decayed upper front teeth already because the mother breastfeeds in the middle of the night in the family bed. Now,
Oh.
I'm a big proponent of breastfeeding. I think that's the absolute best way to get your child off to a good start, but
Mhm.
it's how you do it. It's like anything else. You don't, I recommend you not breastfeed in the middle of the night, but if you do, then you focus on brushing your teeth in the morning as soon as that child gets up. If you don't, you want to focus on brushing your child's teeth at bedtime. So our oral hygiene routine depends on what your habits are now and what we want them to be, because you're going to be the one as the parent to prevent the tooth decay. But if
Mhm.
you don't have the correct information, so that's why I've put together a bunch of educational information for parents. And it's on my website. And I know you'll mention that, but there's all kinds of good information because there's so much misinformation out there now. And nobody knows that better than you, Karen,
Right.
because you've been down the path.
Mhm.
You and I both talked about earlier. But you need proper, correct, viable scientific information. Not just marketing information, I call it. It's just
Mhm.
marketing information.
Right. Uh, and then your products have also had some studies on them. So they've shown that up to 70% that the xylitol toothpaste, and I know there's a toothpaste and a gel. And you mentioned we could talk about the ages of those and why you chose that. But even though it
Mhm.
says it's for children, it is for adults. And anybody can use this at any age and actually should. So I'm just wondering too, since you mentioned brushing a child's teeth who's breastfeeding, I know our listeners are probably also wondering, at what age would you say a child's teeth should start being brushed?
When their first tooth comes in.
First tooth is
The
there,
first
right?
tooth.
Mhm.
Exactly. Kids. But this baby was in the office yesterday. We were one, and everything we gave them the toothbrush when we were done. I let them hold the mirror. I let them hold stuff that's safe. And what do they do with it? First thing they do is put it in their mouth. They put their fingers in there, a toothbrush in there, the mirror in there. They'll put a toy. We give them rubber duckies when they're 1 year old as a little toy or a present. Goes right in their mouth. Everything goes in their mouth. No, seriously,
Yeah.
everything goes in their mouth,
Yeah.
and that's how they feel stuff. So, and again, you don't have to be super aggressive. Just massage their gums, show them the toothbrush. And I connected with this other pediatric dentist out on the East Coast. She recommends, which I found to be a good idea, is brush your child's teeth in the high chair after they finish eating.
Hmm.
They're under control, because the comment I get all the time, I just got it today,
Oh.
for a 2 year old, the mom said, I can't brush my 2 year old's teeth. They won't let me.
Mm.
And I'm thinking to myself, what? You know, you're 5'6" and that your child's what 2 feet tall. No, you brush their teeth because they said they won't stand still, they won't open their mouth, they won't whatever. Brush their teeth when they're in the high chair. It
Hmm.
becomes part of their. It's all about routine. It's all
Right.
about routine. It becomes
They get
part.
used to it, and then it doesn't become a big deal, like a big
It become a
stressful
big
event.
deal.
Hmm.
That's correct. You know, just when they take their spoon away and give them a toothbrush, what are they gonna do with it? They're gonna stick it in their mouth anyway. You
Hmm.
know, so just let them brush their own teeth, and then you help them. It's all about habits. It's all about habits. You
Since you have developed your own specific toothpaste, there's a gel, and I believe you say it's from like 0 to 6 months. I think it's just really because of the texture, if I'm correct. And then from 6 months older, there's the toothpaste. Is that correct?
okay? Well, you're close. What
Okay.
I see, I personally use the gel. I personally use the gel myself, and I'm
Mhm.
obviously over two.
Mhm.
But the point
Mhm.
is, it flows better. And now you don't have to be a great brusher. Just get it in there, and it will
Mhm.
flow over the teeth and flow between the teeth. The
Yeah.
reason, and on the tube of gel, it says for ages 4 years of age and younger. I did that for a reason because I found out a lot of people don't brush their child's teeth till they're 3 years old.
So if you
And I
say
thought,
4 or younger, people are thinking, oh, so my child under the age of 4, I should be brushing their teeth?
correct. I put that in there because people read the labels. They for whatever reason they read a label
Right.
of toothpaste.
Yeah.
So I want them to know they should be brushing their child's teeth. But secondly, is for special needs patients who have oral sensory issues,
Yeah.
which are happening more and more every day, and they don't like gritty, textury toothpaste stuff that's strong flavored or bitter. So my toothpaste is a mild bubblegum flavor.
Hmm.
It's sweet. It's it's not irritating. It's not gritty. It's pleasant. So it's all about the texture and it's
Hmm.
all about the flavor.
Yeah,
Because I used to get
absolutely.
comments all the time. "My kid doesn't like fluoride toothpaste because it burns or it's too
Mhm.
harsh or I don't like the flavor." So
And you
I thought,
don't
well,
want
I'll
to
make my own
swallow
then.
it. Yeah, and it should not be swallowed
No,
at all. Yeah. Yeah.
actually, there's warnings in the backs of some
Hmm.
toothpaste that
Hmm.
if you swallow all of it, you ought to call the 911 or something, or go to the emergency room. It's
Yeah, you're putting it
crazy.
in your mouth.
Correct. Correct.
Doesn't that mean something when you read that you think, something must not be right about putting this in my
Yeah,
mouth? They say that.
right. It isn't. So, but that's the reasoning behind it. But the whole point is they're both equally effective. They both work the same. It just depends on what your choice is.
Right.
You know.
And
So
I want to reiterate that it is for anybody at any age. I've been using it and I love it actually.
yeah.
And I have known about xylitol for years also. And I always, it's like amazing how clean your teeth feel after you use it. But
Mhm.
that's why I think it's important for parents to realize that this is definitely for their children, but it is also for them, for the whole family at any age, because also we want to fight this strep mutans in ourselves as parents and in the siblings and of the special needs kids as well as the special needs kids. The whole family has to be practicing this same prevention and fighting these bacteria so that we can, get everybody healthy and we're not just passing this bacteria around in the family again and just keeping it prevalent and wondering why it won't go away.
Correct. Now we talked about the chemistry of xylitol, about not metabolizing the bacteria that cause acid. I mean, the sugar that causes acid. But one of the physical properties of xylitol is it makes your teeth slick. So
Mhm.
so stuff doesn't stick to it. So even if you don't have tooth decay, you're going to have gum problems. And gum problems is caused by bacteria that form plaque on your teeth that cause gum problems. So if it can't stick, it can't cause problems. So it's not only good for tooth decay, it's good for your gums. And I tell people all the time, you have two sets of teeth, one to look good in, which is the one people care about, and the one to eat it in, which is the one I care about. Well, it takes care of both. It makes your teeth look nicer, but it also makes your teeth healthier. And it really does a wonderful job of maintaining oral health.
Right,
You know?
right.
The last
And-
thing I'll mention is
Mhm.
my toothpaste is the only xylitol toothpaste that's been tested. There's a plenty of xylitol toothpaste out there,
Why
but none
is
of it been tested. Well, I can tell you why, because I'm a good friend of mine does research on xylitol. I won't mention his name, but he's offered to test other toothpaste. But his stipulation is, if I test it, I publish the results. If your toothpaste isn't good, if it isn't effective, then I'm going to publish that. So they won't take that risk.
They
They
don't
won't.
believe in their product enough.
I guess not. And
Mm,
these are, and all virtually, I'd say 95% of all xylitol toothpaste are not developed by dentists. They're
mm,
developed by companies, by corporations. And their goal is to make a product. Of course, they're not going to make a bad product, but their goal is to make a product just so you'll buy it.
right.
My goal has always been to make an effective product because selfishly, it makes my job easier.
Yeah.
It really does. It
Having an
makes my job
effective product,
much
I think.
easier.
Right.
Yeah,
The word effective is the key, that,
right.
it's formulation, I'm sure. Dr. Branham, thank you so much for being here today. This has been very, very helpful. And I want to share with the listeners that on the show notes page, I will link to a discount code that Dr. Branham has graciously shared for his products. And I will link to his website as well. And of course, the product on the show notes at naturallyrecoveringautism.com/207. And you can learn more about oral health from Dr. Branham's website, which again, I will link to. And there will be a discount code on the show notes for you to use as well for the product. So you can try it, see for yourself. I mean, I think it's really important to use something personally before to really understand the benefits and again having the whole family use it. So it gives you a chance to have a discount on a product that you can try for the first time and learn how great it can be, and then know that it's something that you hopefully want to continue with. Because yeah, it's so hard. I mean, I hear from these parents constantly, one mom, it was like 16 teeth her son with autism was going to have to get extracted at the dentist. I mean, it's like half your mouth, and this, these things, we want to prevent it because this is so scary for the kids. So make the experience a pleasant one from early on. Set your own fears if you have them from your experience maybe in the past at a dentist. Set those aside when you are talking to your child about dentists, and make sure that the dentist you see is giving your child a positive experience as well. So especially just even maybe going in one time, like Dr. Brandon was talking about, and having it just be where the child holds the mirror up to their mouth and looks at them, and the dentist isn't doing anything invasive or scary for the child. And then maybe later they can come back and have an experience where they actually have a checkup or something a little bit more like little steps along the way if that's what's needed, because kids with autism have big sensory issues. And so if we can reduce those, for one, that's helpful, but also, this toothpaste is much more pleasant to use because it's sweeter and tastes better. And then it works for fighting this bacteria that is actually causing the dental cavity. So we want to be able to fight that directly. So again, thank you so much, Dr. Branham, for being here, and everybody for, you as a parent, for what you're doing for your child to get educated and educating yourself, staying open to learning more. I always say stay curious, be willing to just explore anything new and learn more. And Dr. Branham has wonderful research on his website for you as well. And again, one more time, the show notes for today will be at naturallyrecoveringautism.com/207. And there will be a discount code for Dr. Brown's product on that page for you to use as well. Feel free to share this with anybody who could benefit from it. There's so many people, obviously, with our statistics we shared here, that are in need of this valuable information, and make sure that people are knowing so that their children can get the help they need to. Thanks again for being here, and we'll see you next time.
Thank you so much. It was a pleasure.
Bye for now.
Okay, bye.